Hello, my name is Jason Dixon. I'm with BevCap Management, and I'm here today to talk to you about your medical insurance through the BevCap Health Program. A couple of things that you need to remember. There's only three. Free, member advocate, bevcaphealth.com. Everything that we're going to talk to you about will be answered in those three little questions. The first thing, Boone Chapman. Boone Chapman is your third-party administrator. They're going to house the member advocate that we just talked about. You have their website, their email address, and their phone number. Anything that you need to do, if you want free services, we're going to provide you with a free card that will have the 800 number and the email for the member advocate to direct all of your services throughout the year. Aetna. You have Aetna's network. Their largest national provider of all their surgical centers, their hospitals, their providers is the Aetna network, but you don't have to remember that. You can call the member advocate. They will schedule your doctor's appointments for you. Make sure that the doctors are in the network. The next one is Envision RX. This is referred to as a PBM or a pharmacy benefit manager. What this really means is there's over 67,000 pharmacies nationwide. It's going to be hard pressed to find a pharmacy that is not included in the Envision network. Always make sure that you go to your local grocery store chains because they're going to have the most cost-effective medical prescription drug benefit. This will be your ID card. As we mentioned, we have the free card, but we also have a hard plastic ID card that you'll be getting in the mail. Your company's logo will be on there, all your personal information, Envision, which is your prescription drug benefit, Boone Chapman, who handles all the claims, and Aetna for the PPO network. Your Call-A-Doc will be on the back side of the card as well. All of your benefits will be here, so whenever you go to your pharmacist or to your provider, show them your new ID card, let them know that the benefits have changed, and they'll be able to have all their information. Consumerism. What is consumerism? This is a chance for you to take in charge of your health care. Make sure it is your responsibility. Do the research, feel empowered. We want you to take full advantage of all the services that we have to render, but in order to do that, make sure you reach out to the member advocate. They'll walk you through everything. How to be a good consumer. We have the largest national network available, Aetna Signature Administrators PPO. Avoid unnecessary visits to the emergency room. ERs are the most costly benefit that you could utilize. However, if it's life or limb threatening, make sure you go to the ER. But if not, utilize your urgent care centers, utilize the Call-A-Doc that we're going to talk about. Generic prescriptions. If your doctor prescribes a drug for you, don't be afraid to ask, is there a generic available? Because obviously it's lower cost to the overall plan, but also a more cost-effective copay for you. Pharmacies, always looking for the local grocery chain, i.e. a Walmart, a Costco, a Sam's, instead of the standalone pharmacies, but they're all included under your health plan. And then if you're on a maintenance medication, 90 days to fill the maintenance medication. As we talked about, use an urgent care instead of an emergency if it's non-life or limb threatening. And then obviously the best solution is Call-A-Doc, which we're going to talk about that for your entire family. So a couple of examples of when to use the emergency room versus the ER and vice versa. If it's non-life threatening or you just have a sudden illness or injury, it needs medical attention, but it doesn't need the ER. What does need an ER? Life or limb threatening. If you're under the impression that you're having a heart attack, go immediately to the ER, get it taken care of. But if little Johnny scratched his finger and it just needs a Band-Aid or a stitch, make sure you're utilizing the urgent care. It'll save you money, save the plan money. So we talked about this quite a bit, but it is life or limb threatening. ER is the most expensive medical treatment you can get. Be careful. A lot of the new emergency rooms look like freestanding urgent care clinics, but they're actually emergency rooms, and this will cost you more out of pocket if you happen to go in there. Don't be afraid to ask them when you walk into one of those new facilities, are you charging me urgent care prices or emergency room prices? So now let's get to the free services, the things that are important. What are you going to use on a daily basis? Call-A-Doc, we're going to talk a lot more about this here in a little bit, but 24/7, 365 days. If you have a need, probably 75 to 80% of all of your services can be covered under the telemedicine through Call-A-Doc. But what if you need a surgery? Maybe a orthoscopic knee surgery or rotator cuff, ear, nose, and throat. We have 15 surgical centers across the country. You don't have to remember those. All you have to remember is call the member advocate. They will direct you and take care of all of the logistics in getting you prepared in those, and we'll talk about that. USI Imaging, basically we have 2,200 centers across the country. So if you need an MRI, a CAT scan, PET scan, any of those situations, you can go to one of our facilities and it's 100% free. OneRx mobile app, as we talked about, prescription drugs are very expensive and costly today. We have a free app, OneRx. GoodRx is another one. Utilize those apps, they're free, and they'll show you the exact cost of the drugs at the different pharmacies. And then the last thing we're going to talk about is care management and how Boone Chapman and Prime DX work in conjunction with the health plan. Preventative care. So this is a free benefit under the ACA, or also known as Obamacare. Make sure you go and get your annual physical. We want you to have a relationship with your local provider who is administering that annual physical, so you can have a checklist each year and understand how you're progressing along the plan. But make sure you go and get your annual physical. Call-a-doc. This is probably the most beneficial benefit. If you're like me and have kiddos and have to drive into the doctor's office, take a half a day off work, schedule it, sit in the waiting room for 30 minutes with 30 other snot-nosed kids just to see the doctor to get prescription, now you don't have to. You can lay in the bed, pick up the phone, call the doctor, have a prescription waiting for you in 30 minutes. If you don't remember the number, it's right here. We have the website. We have the 1-800 number also on that free benefits card. Call-a-doc's information is right there readily available. And if you forget, you can always call Member Advocate. They can help direct you. But as you can see, there's about 25 common occurrences, whether it's acid reflux, asthma, diabetes, a fever, high blood pressure, poison ivy. Any of these examples are just some examples. This is not an all-inclusive list. Give the doctor a call. The other huge benefit about this, it's not just for you, the employee, but anyone in your family. As long as the employee is covered under the health plan, all members of the household are covered under this program. One point of note, make sure you go and register, because we will want you can either call or go online and register the family, because it is a live doctor on the other end of the line. We want to make sure you get all of your medical information loaded into the system. Surgeries. Now, under your health plan, you're going to have your annual deductible and your annual co-insurance and out-of-pocket. And you have the choice to go to any of the local hospitals that you're utilizing today, but you'll pay your deductible co-insurance. If you need a surgical benefit and you're willing to call the member advocate will take it from there. Once you've been chosen for the surgery, they will determine which of the 15 surgery centers across the country best fit your needs. We'll then be able to coordinate everything from there. We will pick you and a significant other in a black car service. If you need to travel out of town, we'll take you to the airport, pay for both airline tickets, give you $100 per diem per day. Once you're there, you'll arrive in a 4-star hotel. There'll be a goodie basket waiting for you saying, hope the stay is enjoyable under these circumstances. We're going to give you $1,000 for going to one of our surgical centers. We're going to waive the deductible, waive the co-insurance, zero out of pocket. So under this scenario, you're going to get to go to one of our centers of excellence across the country using the top surgeons in their fields and zero out of pocket for your surgery. Under your plan, you can also use your deductible co-insurance, or you can utilize one of our 15 surgery centers. How does it work? We just kind of hit it, but basically when you determine that there's a surgery, you're going to call the member advocate. They will work with you to get the medical records from your local provider or help you find a provider in your area. They review all of this. The nurse advocate directs all the travel and costs up front. You'll receive the high quality care, but most importantly, there's zero out of pocket to you and your family members. Imaging, we talked about USI program. This is the CAT scans, MRIs, PET scans, any high-end imaging. We have 2,200 locations across the country. If your doctor or physician prescribes that you're needing an MRI, call the member advocate. They will coordinate one of the locations nearest your location. You go, zero out of pocket to you. Once again, here's a big copy of the free benefits card. As you can see, We're directing everything through the member advocate. Hit the 800 number, option 3. If you want to email them, their email address is right there. And obviously the Caladoc phone number is right there for all the free services. We mentioned the OneRx. This is a prescription app. Download it on your smartphone. When your doctor gives you a prescription, plug it into that app, give all the information, hit map. It will map out where the lowest cost the pharmacy is for that particular drug. So when you're having to pay your out-of-pocket, especially if you're on an HSA type plan or you have high deductibles and you really want to know where the best cost is, this is a great tool and app to utilize for those services. We talked about care management and disease management. If you get something in the mail from Boone Chapman / Prime DX, they are here to assist you. We understand that healthcare is very complicated, and we're trying to simplify that process as much as possible. So we have hired care management and disease management nurses to reach out on your behalf to help answer those questions. Give you a couple examples on disease management. If you have asthma, diabetes, high blood pressure, they're going to help you through that process and give you information. It's almost like a nurse coach. So if you get a call or an email from Prime DX, please return it. They're not trying to be the big brother. They're trying to assist you and help you along this because you're already going through complicated medical conditions. Don't make the insurance side of things even more painful. Let them take that burden off. Care management, if you are in that situation, that nurse and care manager is going to help you facilitate because you may be seeing 5 different physicians. That care manager is going to help coordinate all of those visits and prescriptions and diagnosis together in one single house. So Prime DX is your case management and disease management to help this complicated healthcare maze become easy. We kind of talked about it is a dedicated nurse. You're going to speak to the same nurse, so you don't have to explain your issue multiple times. Once you have that direct relationship with that nurse advocate, they will be the same person you speak to every time. It's also a two-way street. So if you have questions about certain conditions, maybe a family member's been diagnosed, not necessarily affecting you, but you want to reach out, you can obviously do that. They're there to educate, answer any questions you may have, provide assistance, as we talked about, including benefits and claims analysis, and then also your personal health. This is 100% confidential. Your employer doesn't know about this, nor does anyone else. This is 100% between you and the nurse advocate. We talked about BevCapHealth.com, and we've talked a lot about the member advocate. But if you're one of those ones that like to do everything online, or maybe late at night when the member advocate centers are shut down, you can always go to BevCapHealth.com, and everything that we've talked about here is right there. All you have to do is click on your company's logo, know your member number, your last name and date of birth, hit sign in, and everything that we've talked about is at your fingertips. Let's say you want to locate a provider and do a provider search. All you would do here is type in the information for your provider, hit search providers, then a list pops up. We make it user-friendly. As you notice, there's one with a gold star. What that represents is that's a free surgery center. It's going to come to the top. So if you were needing an orthopedic surgeon, boom, Surgery Center of Oklahoma or Texas Free Market may show up, or Ocean Surgery Center in California. Wherever you're looking to provide services rendered, this will pop up in your population. Now you can choose any of the providers in the section, but we're also going to drive you or steer you to the low cost or free providers. Once you've selected a provider, this is an electronic health ticket. You can print this out, you can text it to your doctor, you can email it to your doctor. But this is all of your company's benefits, what you've chosen. This is actually what an ID card would look like. It also accumulates all your deductibles, out-of-pockets, everything you've met. So once you send this to your provider, they have all of your benefits right when you walk in the door. For those of you that want to look at detailed claims and explanation of benefits, or just go online and find all of your medical history through Boone Chapman, obviously through the same site, you can log in straight to the Boone Chapman website, plug in your ID information, and all of your personal medical history is right there at your fingertips. So the last thing we really kind of want to leave you with, the member advocate, this is your one-stop shop. All you have to do, if you don't remember anything we talked about, reach out to the member advocate. They will take care of everything. They'll answer any questions you have about your benefits. If you need them to schedule you an appointment with a doctor, they'll do that. Or if you're just bored on Tuesday afternoon and no one else will talk to you, they're waiting to hear from you. So give them a call, hit option 3, and one of our 4 dedicated member advocates will reach out and answer all of your questions. If there's no other questions, you can always reach out to us at BevCap at 469-424-3419, or as we said, free member advocate or bevcaphelp.com.